There are some essential blood tests such as PTT, PTINR to monitor the patient who are undergoing anticoagulation therapy. But the question is, which test with which drug? Is it with heparin or is it with warfarin? So it's quite confusing at point. So here after no more confusion, we will make it very simple. Now, why it is necessary to monitor the anticoagulation therapy? Before going, the anticoagulation therapy, it does nothing. It will prevent the clot formation. Especially when now we're giving anticoagulation therapy, especially with the patient who are recovering from myocardial infarction or those who have at risk of deep vein thrombosis. So when you give the anticoagulation therapy, it will affect your clotting cascade and it will prevent the clot formation. So there is no more clot will be formed because your blood will be thin. But the problem is if the blood is too thin, if you are giving the anticoagulant, what happens? It will start bleeding, isn't it? So that shouldn't be happen while you are giving anticoagulation therapy. So that is where the importance of blood monitoring comes. So when you test the blood of your patient, you will make sure that the blood is thin enough to prevent the clot formation, but it is not that so thin to cause excessive bleeding. So there is a boundary. That's what we are checking with the blood test while your patient is on anticoagulation therapy. So to simply to adjust the dose and prevent the bleeding, you are checking the blood of the patient while the patient is in on anticoagulation therapy. We'll start with a question. First one, which laboratory test is used to monitor the therapeutic effect of warfarin? Options are A, activated partial thromboplastin time, that is PTT, APTT, B, PTINR, C, bleeding time, D, platelet count. The answer is B, PTINR. So with the warfarin, it is PT. The second question, which test is commonly used to monitor the therapeutic effect of heparin? Options are A, prothrombin time, B, activated partial thromboplastin time, C, international normalized ratio, D, fibrinogen level. The answer is B, activated partial thromboplastin time, that is PTT. So simply, when you monitor your anticoagulation efficiency, the warfarin will go with PT and the heparin, if you give, the blood test will be PTT, is activated partial thromboplastin time. Now, the question is how to remember. So it is simply take your two hands and start spelling it. If it is heparin, you start spelling HEPARIN. So how many digits are pending? It's 3 digits, is it not? To make it 10. So we have PTT and PT confusing. So definitely to make it 10, we have 3 remaining. So it will be PTT, very simple. So with the heparin, we check PTT. Yes, the principles goes the same. If it is warfarin, you start spelling it. WARFARIN. And how many remaining? The digits are 2 remaining to make it 10. So with that, we have PT, PTINR. So the warfarin, if you are the anticoagulation therapy, the blood test you need to check is PTINR. Isn't it that simple to remember? Okay. For more such videos, please like, share, and subscribe the channel Nursing Exam Insight, your ultimate resource for all nursing exams.